Dr. Pino Mavengere from Wits Business School. I'm the program director for a new program which started 2 years ago, MBA in Healthcare Leadership. We found that there was a need, especially in South Africa at this time. We're trying to introduce national health insurance. There's lots of changes in the world and in South Africa as well. So we're trying to create leaders who will be able to grasp with these changes and make a difference. So rather than just have a general management approach to MBA, we looked at the healthcare leadership, which can craft new business leaders for our country, but not our country only, regionally and globally. There's globalization. So we do have competition coming in, and also we have to step up and meet what's happening in the rest of the world. That's the first point. And then also healthcare financing is a particular issue in Africa. Okay, governments struggle with financing public healthcare. We used to depend a lot on on international donor agencies, and as you know, the atmosphere is changing very much, which probably calls on us to become self-sufficient, to look at leaders who can look at solutions, local and global, which we can implement to address the issues which we have. We have the normal disease challenges, of course, infectious diseases, but also, fun enough, diseases of opulency. So diabetes and hypertension are also growing within the population. So we need to have people who can address those challenges via any sorts of interventions we have, whether they are management or leadership or even clinical. We need such leadership. What we did was, rather than focus generally on the medical school alone, because it tends to be very clinical, what we did, we took it a stakeholder approach. So among our stakeholders are the medical schools, but so are the departments of health. We've got 9 provinces. So are the NGOs in the healthcare sector. So are the regulatory authorities. So are the hospitals and doctor associations, nurses associations. So we look at all those as stakeholders in our program. We do invite them, and specifically with the medical schools, is to try and introduce this idea of thinking beyond clinical, so that our doctors don't just think about the patient. They also recognize there are costs involved in treatment, and there are also financing issues we've got to give bearings to, and funds are always limited. What we did when we were designing this program was to realize that, as you said, there are people who are in the healthcare sector to do with administration, management, and so forth, but then there's also the individual practitioner. We tend to say doctors, but in South Africa today, even physiotherapists, optometrists are becoming private practitioners, and nurses in the primary care sector, as we go to NHI, they need to be able to manage the businesses. I'm a doctor myself. We're not trained in business management at school, neither are pharmacists. So all those people would need to be trained in leadership, because if you think about it, they're going to be the deliverers of the service we need. And they need to have those leadership qualities beyond the domain sort of clinical knowledge. So we do take from them. In fact, our new class has got more clinicians than the past one. The past one had a lot of people from the industry, from the medical schemes or healthcare insurances, from the pharma and so forth. But this year we were able to attract a bit more private practitioners who are kind of a small business in a way. They're not huge businesses, whereas the others are financed by corporate. So even that challenge in putting together has been quite something exciting, that we're able to attract from both sectors of the health sectors, subsectors, yes. We say that leaders are people who should be able to deal with ambiguity, people who should be able to deal with fuzzy things. They create a solution where there might be none. So they should be people who exhibit critical thinking. We're able to solve problems that might not have been there before. So we almost say, as a leader, you know you're going over a horizon. You don't know what's behind, but you've got to prepare for it. So how do you prepare for it? So they have to be able to do scenario planning. They have to be able to deal with unknown things. They have to be able to create a vision and mission and keep to it. Remember, you navigate towards it. So we almost use the example of a gyroscope. It's not a straight line. You meet obstacles. You need to bypass them. You need challenges. COVID was such a challenge. It was unexpected, but as a leader, you can't sit around and do nothing. That's some of our case studies, that we had to sit down and find a solution of these unknown diseases. So we want to look at leaders who are able to deal with uncertainty, but then use practical decision-making tools, decision-thinking tools, planning tools to be able to have the best shot. We always say things can change anytime, but you should be able to adjust and meet your target or your goal. Of course, leadership is very important. There's healthcare leadership module on its own. There's strategic planning. There's economics. We also have, of course, it's a research-based approach. We must come up with a research product that produces research that is useful in the industry. So research methodologies is part of it. We also look at health systems, various aspects, and we can't ignore the global trends. So we've got a global trends module and also digital enterprise, which are very important today. And then we also look, you can't do leadership without talking about health system strengthening in the electives and so forth. And of course, interestingly, marketing, which has got its own nuances in healthcare. People have to be able to do marketing in a good way, in an ethical way. And then we also look at organizational development, which is very important, and talent management, which has become so different today with all this digital transformation, AI and so forth. How do we craft new talent that can deal with it and not be afraid of it, but use it for the success of the organization? Then what we also did, which is particularly different about our program, was very successful. As part of the design, what we looked at, what would make busy healthcare professionals be able to attend lectures. So we have a binary approach to it. We've got in-person lectures at the beginning, then online. So this blended learning allowed us to reach out to, most people didn't know why doctors and other healthcare professionals don't want to do sort of post-grad training, but it's simple, they're so busy. If you're on call the whole weekend, how can you study and all that? So we put that into our program. As a result, our attendance rates unbelievably above 97% for the past 2 years in attendance because of the online training which we're doing, which is crafted for that. If you are a person who likes challenges, who likes to create solutions for hard situations, which healthcare is, and you don't have to be a doctor, you don't have to be a neuroscientist, as long as you work in the healthcare sector and you want to lead your section, you don't have to lead everyone to a direction you want to go. We give you the tools, the thinking capability, and the approaches for you to be able to reach your goal. And so what it is about healthcare leadership.